listeners, welcome to CAMPKU. This webinar is brought to us with Innomar Strategies, one of our sponsors, and it is Chronically Simple, an app that's been designed to help us with our maintenance. I know I've gotten a lot of excited emails about this once the announcements went out. So I'm going to pass it over to Christy and she can take over and let you know everything you need to know. There you go.
Thank you. Hi, my name is Christy Dickinson. I am the founder and managing director of Chronically Simple. I guess I'll share my screen. We've got a slide deck and then I'll walk you through a demo of our tool. So I always like to start my presentations with a little bit about myself. I am a rare disease patient. I live with Ehlers-Danlos syndrome and ankylosing spondylitis and a few other comorbidities. That really, I share my personal story because it precipitated what I'm going to show you. My journey to diagnosis was about 7 years, and during that time, I really struggled with getting my health care in order, I guess. My healthcare is divided across 3 different hospital jurisdictions and 10 different specialists. And, living in the rare disease world, a lot of that journey to diagnosis, and then you get your diagnosis, and where do you go from there? And what does that look like? So I am a mother of 3 young children. Before I started Chronically Simple, I worked in HR. I was a recruiter and just kind of trucking through life. And then my health started to deteriorate. And with each pregnancy, my health deteriorated a little bit more to the point where I had to close down my business and take what my family and I referred to as the pause. So I gave myself a year to try to get my health under control. I was in crisis mode, in and out of hospital, fighting infections that became antibiotic resistant, having all sorts of complications. And really, I just struggled to try and keep everything together because I am a part of the rare disease world, and like you all are. We know that oftentimes the patients and the caregivers are the conduits of information to our healthcare providers. Depending on who you end up with managing your care, oftentimes you are the expert in your disease, and I believe that we are all the experts in in our health, or if we're caregivers, the health of our loved ones. No one knows better than us what we need and how we feel. I was used to always kind of being in control. I ran my business. I managed our household. I was on PTA. I was very active in my life, and I struggled when I got sick with feeling out of control and feeling like I was kind of like a ping pong ball in our healthcare system, being bounced from specialist to specialist. And I struggled with the silos that our healthcare system is built in. So knowing that our specialists don't always speak to each other, or information doesn't make it to all of the healthcare providers that are involved in our care. I couldn't remember to take my medications at times because my cognitive ability was impaired as a result of the treatments that I was on. So I thought there's got to be a better way to keep everything together because I was forgetting so much. So I went to my network and talked to my friends and my family that were on different healthcare journeys, and the results or the answers from everybody when I asked them, how do you guys keep this all together, was always the same. Everyone said, we have binders or file folders, but more often than not, it was binders. And so I too started to keep paper copies of all of my interactions, all my hospital discharge summaries, any medical test results, diagnostic imaging, blood work. And then I would bring those with me to my doctor's appointments. And that eliminated some of the back and forth of I would go to an appointment and my neurologist would need to see a copy of my MRI, and because he hadn't been copied on it, if it wasn't there, then my appointment would have to stop. So I started really being that I guess project manager of my health. That binder became a very important part. Like, I will say at times as important as my kids were, because without it, my healthcare would stop, or my continuity of care, my access to treatment would stop. So again, I thought, well, there's got to be a better way here. There's got to be a digital solution, something to keep everything together on my phone or my laptop. And when I went looking, there are tens of thousands of health and wellness apps out there in the App Store and in Google Play, but there wasn't one. And what I wanted was just one thing. I wanted to digitize my binder. So I needed one app that held my medication tracker, my symptom tracker, my appointment tracker, all my healthcare provider information, all my medical expenses. And I struggled to find one centralized hub. So I told my husband that I thought that I needed to build one. And that began the last 5 years of my life. I'm very excited today to talk to you a little bit about Chronically Simple. So, what are we? Well, we are a web-based and a mobile app that is basically a centralized hub that helps you keep everything related to your health, or as a caregiver, the health of your loved one, in one secure location. We are stored in the cloud within Canada. I am a user. I built this tool alongside patients and caregivers. Every data point that I'm going to show you in the demonstration has been built by a patient or a caregiver's experience. But as a user, I know how important our privacy and our security of our personal health information is. So it was very important to me that we build a solution that, if anything were to ever happen to our phone or our laptop, that all of our information wouldn't be lost. So that's why it being a cloud-based solution is important. We ultimately, our business is the foundation of it is that empowered patients or caregivers have better outcomes. So if you take an active role in managing your care, you have better ability to advocate for yourself or your loved one. You feel more empowered to have discussions with your healthcare providers because you have all of your information right at your fingertips. So that is Chronically Simple in a nutshell. We have a lot of features. So we've tried to simplify what is a very complex system and complex health conditions and put it into a very easy to use tool. So a few features, and I'm not going to spend a lot of time on this slide because I'm going to walk you through the tool and show you how it works. But a few features that you won't see in our web app right now is the fact that we are integrated with any wearables that you might have. So Fitbits, Apple Watches, Garmin's. We have our symptom trackers integrated with those wearables just to provide a broader picture of things that might be impacting how you're feeling. We are a shareable solution. So if you have a care team, for example, my sister comes with me to all of my appointments that are in Toronto. So she's a part of my care team. She has access to my health information that would be relevant to the appointments that she comes with me to. My husband comes with me to all my local appointments. My dad comes with me to some of my other appointments. So the tool is shareable. You can invite people in your support team or your care team to download the app, and then they have access to information that you give them access to. And our newest feature is our vaccination tracker. That's also not in the web app, but I will talk through what that looks like during the demonstration. I think what I'll do is exit out of this and go right into, let's see if I can make this smaller. Okay, so I hope you all can see my screen. Someone tell me if you can't. When you log into Chronically Simple, you're brought to a home screen, and that is your day at a glance. I will start by saying you There are two ways to register for our tool. You can register either as a patient or as a caregiver. The features are the same, but the user experience is different. And where that really came about was when I was building this tool, my partner, Brenda, she is a caregiver. Her son is very medically complex. And what I learned from working with her is that our emotional journeys are very different. So the way that I experience our healthcare system as a patient is very different to her experiences being a primary caregiver to her son. So we wanted to make sure that we honored both experiences within the app. For our demonstration today, this is a patient profile. So I'll walk you through as though I'm a patient managing my own healthcare. So on the day at a glance screen, we have up at the top here, we've got view, and this is our multi-user functionality. So I have the ability to track and manage my health as well as the health of my 3 kids and my elderly father. We can manage up to 6 profiles, and if you click on them, you'll see just what's on tap for that person today. Joe Patient has a lot of things on tap for him, or you can click on all and you'll see everything that we have going on today. The day at a glance screen is really just it is your day at a glance. So any medications that you have to take would be on this screen. Any appointments that you have, anything to do with your health that is relevant for today that we need to know or action on would be on this screen. The reason that these boxes are in red are because these are medications that have not been marked as taken. The way that the tool is set up, when you input the information, so Joe Patient has a lot of medications that he has to take on a daily basis. Much like any other app that you use, and I'll use Facebook or Instagram as an example, you'll get notifications from them when they want you to action on something. So Chronically Simple is the same. You don't need to be in the app. But you will get a push notification when it's time to take your medication. So I'll get a, hi, Christy, it's time to take your methotrexate. And then from my home screen of my phone, I can just mark the medication is taken. It timestamps what time I've taken it. And it also lets my care team know. So those people that I share my information with, it updates them that I have taken my medication as I'm supposed to. Where that's important is, if I'm caring for my dad, or part of a part of his care team, especially during this past year when we don't have the access to our loved ones that we normally do. It's a way for me to easily ensure that he is taking his medications or going to his appointments without me having to physically pick up the phone and call him every day to validate or verify that. Over here on the left-hand side, we have our features menu. So there are a lot of features, but I promise you it is not hard to use. One of the testers on our app is my 70-year-old dad, who didn't know that his doctor actually kept his health information in a computer before I started on this Chronically Simple journey. So if he can do it, I'm very confident that anyone can. So over here on the left, we have our appointments section, and this is a calendar that is tied to your iOS or your Android calendar on your phone, and it just houses all of your medical appointments. So we can see here today that we have a chest x-ray from 1 till 2. We know who the doctor is that ordered it, any medications that are associated with that doctor, and then any appointment notes. So I usually go to my doctor's appointments with a list of questions and things that I want to talk to them about. Again, as a result of this pandemic, a lot of our appointments are now virtual, and our time with our specialists is really, really, sacred. We don't have as much time, and for caregivers, it's up to you guys to relay the information very clearly and efficiently to your healthcare providers so that they can make decisions based on the historical information that you're sharing with them. So this appointment notes section is where you can get prepared for your healthcare appointments, so for your specialist appointments. anything that you want to talk to them about since you last saw them, any questions that you might have, any symptoms you want to talk about, you would enter those in your pre-appointment notes. And conversely, after your appointment, you can enter your post-appointment notes. So this is what we talked about. This is what my next steps are. I need to try this medication, or I'm going to go for a follow-up x-ray. I'm going to report back in 3 months, whatever it might be, you would enter those in your post-appointment notes. Where that becomes helpful is if you only see your specialists once every 6 months, you have the ability to refer back. Okay, in our last appointment, we talked about this, this, and this. That refreshes my memory, so I'm going into this appointment well prepared. Our medication section is where we keep track of any daily medications that we take. Our active section is for any medications that you might take on a weekly, bi-weekly, monthly basis. Anything that isn't your typical, take this once a day would be in that section. And then your expired medication is really, for lack of a better term, it's medication that you have taken that you're not on anymore. So anything that you may have tried and hasn't worked or didn't help you would go in this section here. Where that's helpful is when you're seeing a new doctor and you can't remember, 3 years ago, 4 years ago, I was prescribed Cipro. Oh yeah, I took it for an infection. It didn't work, and it's actually contraindicated for people like me, people with my condition. So I can't have this prescribed again. I probably wouldn't remember that just off the top of my head. So that's why this expired section is important. The way that the medication section works is you can see here the information on the medication that you're on, who you've shared it with. Typically, there would be a name there and a picture. When the refill is, any appointments that are tied to this medication, the ordering physician, and then any prescription notes. So we know that patients and caregivers will often handwrite on the bottle, heart medication, stomach medication, you'll write on the bottle or you'll capture it somewhere why you take that medication. So that would be held in your prescription notes section. And again, these are in red because they haven't been marked as taken. Our document section is basically that binder. So all of the information that that I kept and all of my test results that I've asked for, I now snap a photo of with my phone, or I can scan and upload into the app and capture them here. Our users have the ability to create their files their folders in whatever way best suits them. So for example, in my personal application that I use, I have CT scans, MRIs, blood work, x-rays, hospital discharge summaries. I have a bunch of folders, and then all of the relevant information would be in those folders. We also have a section for education material. And where this is exciting is when we partner with advocacy groups or patient organizations, patient support organizations, any information that they want to share with you that would be relevant to your diagnosis or, new research, just anything that would be relevant to you, that advocacy group can share with you in your education material. And that way it's here and you can take a look at it at your convenience. I've got an example here of our COVID vaccination information sheet. So this is what I got when I went and got my vaccine. And then I uploaded this information sheet so that I could refer back to it at my convenience, rather than, when they hand you the piece of paper and then you come home from the appointment, you put it on your hall table or your island in your kitchen and you never look at it again. This way it's here, and if in a week or a month I want to refer back to it, I know that I've got it all stored in my education material. Our physicians section is basically I kind of consider this to be the heart of the app. When I think about how we've built Chronically Simple, everything kind of, the physician is at the center and everything spreads out like a spider web from them. So this is an address book of every specialist that would be associated with my care. And then when I click on more information, I've got their office location. We are attached to Google Maps, so if you need directions on how to get there, the app will direct you. All of my past appointments with the rheumatologist, all the medications that they've ever prescribed me, any documents associated with this healthcare provider. I can call them from the app, I can email them from within the app, and then any notes that I might have. So why do I see the rheumatologist? What do I need to know about him or her? Just basically anything that would be relevant for me that I want to know about this doctor, I would house in this section. We've got a pharmacy's address book. So we know from our users that people will fill their medications and their prescriptions at locations that are most convenient to them. Sometimes that means if you're seeing a specialist in the hospital, you'll fill that prescription at the base in the pharmacy in the hospital. Other times you fill your prescriptions at your local Shoppers or your local pharmacy, whatever is closest to your home. If you're on a specialty medication, then you'd have your specialty pharmacy listed in here, who your pharmacist is, what the location is, and then what do you fill at that pharmacy. Our support services, this is basically anybody secondary to your specialist that would be involved in your care. So this section was built out because, especially for complex patients, if you have a lot of people involved in your care outside of just your specialist, so I'm thinking like occupational therapist, speech therapist, social worker, naturopath, dietitian, your LIN or your at-home nursing, any medical device providers, that all of those people would be housed in this section. So I go to Motion Specialties, they are the wheelchair provider, here's their phone number. Typically you would have an address there. That address book of just anybody that outside of your actual specialists who is a part of your care team that are housed in this section. The care team I touched on, this is those people in your life, your friends and your family that you've invited to download the app and share this medical information with, are housed in this section here. So typically, we would show Brad, he's my spouse, here's his email, he's accepted the invitation. And then Brad can make any notes in here, any pre-appointment notes or post-appointment notes. I have the ability to see anything that they would add in this section here. It's that continuity of care. That's why this care team is so important. So if ever I'm not able to advocate for myself, or if you're a primary caregiver for your loved one, if you're not able to participate in their appointment or advocate for them, someone else can pick up the role and not miss any pieces, have full access to whatever is needed to make sure that whoever is looking after me or whoever is looking after your loved one has a full and complete picture so that they can properly care for them. That's why this section is so important. We've got our medical expenses section. So I personally found it very daunting to keep track of my medical expenses. And I know from our pediatric caregivers specifically, there are a lot of grants and funding opportunities that are very, very time consuming for application processes and to keep track of the medical expenses. And we know that grant and funding applications follow their own schedule. So some might have to be renewed every 6 months. Some might be renewed every year. Your disability tax credit is a yearly tax situation. So having one centralized location where you can keep track of your expenses was a much, much requested feature from specifically our pediatric caregivers. very easy to upload. So when I drive into a hospital and I get that little tiny parking stub that's the size of a business card, I snap a photo of it with my phone. It uploads directly into the app. I just click on the expense is hospital parking, merchant, 3P, today's date. It cost me $17.50, and my expense type is parking. So we've got a whole list of expense types here: medical device, medical supply, supplement therapy, travel, and then of course your catch-all is other. I just press save, and it uploads it into the month. The system is intuitive, so it will tell you what you typically, it'll get to know what you typically spend each month, and it will alert you if you have a month where you've overspent. This whole section is easily uploadable at tax time for QuickBooks to your accountant. It's uploadable and shareable for any funding opportunities that you have. So it's just basically trying to help our caregivers and our patients keep track of those, those little parking stubs, the receipts, rather than keeping them all in an envelope. Here you've got them kept track of, tied to appointments. And if you're ever audited, there's a trail as to why you spent what you spent on your medical expenses. Our symptom tracker, this is one of our latest features and something I'm very proud of. This was built by our patients and caregivers. They wanted a way to easily keep track of how they are feeling, and then, be able to reflect back over time. So we know when we go to a doctor's appointment, they'll ask us, how have your symptoms been? And we will tell them how we're feeling in that moment, or maybe in the past 24 hours. It's really time consuming to keep diaries or keep track of how you're feeling in the months that between appointments. So while I might self-report that I feel great today, I do have the ability to easily pull up the app and say, okay, well, I'm feeling great today. Since I last saw you, I've actually been 5 out of 10 average for fatigue, or a 5 out of 10 average for pain. So it just provides that more holistic picture to our healthcare providers, so that they can make appropriate treatment decisions. Super easy to enter in our symptoms. So I'm going to just choose, who am I entering in a symptom for? I'm feeling tired today because I've got pandemic fatigue and 3 kids that are being homeschooled right now. Feeling some pain because it's still cold outside. Pain is in my knees and in my ankles. My stomach feels good today, but because I'm tired, I've got some brain fog because of COVID. I have to keep track of my temperature all the time. Click on next. Any external factors that might be impacting how I'm feeling. So I mentioned it's cold and I'm under a bit of stress. Any notes that I want to make note of. So what might be impacting my symptoms that is above and beyond my disease? So I'm feeling tired. Tired due to kids not sleeping. So that isn't as a result of my disease. It's because I've got 3 busy kids and they didn't sleep last night. So it's, again, just making sure that we've got a whole picture there on how we're feeling. The nice part about this symptom tracker is it is completely customizable for your condition and for your symptoms. So this is a consistently growing list. I've only shown you a few in the demonstration, but based on what is relevant to your condition or the condition of your loved one, you have the ability to customize your symptom tracker accordingly. So if you want to keep track of seizures or tics or behavior or diet, that can be done in this section. And if there is a symptom that is important to you that isn't on our symptom tracker, we have built this from our patient or our user feedback, and we continue to evolve this section based on that. So if there's something that is relevant to the person that you're caring for or to your condition that isn't on our list, just send us an email and we'll get it added for you. And then finally, we've got our achievements section. So this is in the world of app building, it's called gamification. And basically, it's our way of rewarding our users to engage with us on a daily basis. So to mark your medication as taken, to enter in your symptoms, to enter in those pre or post appointment notes. We pulled a little bit from Snapchat with the streaks. So, you get, if you enter it in every day, the app kind of shoots balloons at you. And then we pulled a little bit from the Fitbit badge. So you get trophies that reward you for interacting with the app on a daily or a weekly basis, whatever is relevant to you. And finally, we've got our profile section. So when you register for the tool, as I mentioned, you would set yourself up either as a patient or a caregiver. Typically, you'll have a photo of yourself here, your name, your phone number, your address. All of your health information is stored in this section. Your health card, your insurance provider. You can snap a photo of those and upload them, and they're housed in the app. All of your diagnoses, any allergies, any blood type, and then any notes that might be relevant to your condition or to your care that aren't held in the other sections of the app. I think about the pediatric caregivers. So, and this is a generalization, but the mom brain. So things like I need to take my medication with apple juice, or we like to bring this stuffy with us when we go to the hospital. This music needs to be playing when we get blood drawn. Things that are important to the quality of life of the person that you're caring for, or of myself as I navigate my healthcare, but wouldn't, it's the stuff that we hold in our brain. That's what the notes section is for, just to get those things out of our brain. So if anything were to ever happen and someone needed to pick up the care, they would know that I like to take my medication with apple juice versus water. And I think that's it for the demo. I will go back to our presentation here. Oops. Sorry, just symptom tracker there. Oh, sorry. What I didn't talk about was our vaccination tracker. So that's our newest feature, and it will be live. It's live in the mobile version of our tool right now, and it will be live in our web app, hopefully by the end of the month. And it's obviously in response to COVID and the fact that the COVID vaccines have rolled out in Canada, and we need a place to track those because they're relevant to our medical information. But what we've done is we have now captured every vaccine that is approved by Health Canada. So those little yellow cards that we have, I have them for each of my 3 kids, and it's got, their MMRs, any tetanus, their flu vaccines. I needed a place to digitize that yellow card, because if you lose it, then, you get the mean letters from public health that your child's going to be kicked out of school if you don't provide proof of vaccinations or immunizations. So our vaccine tracker is just basically digitizing your yellow card. And then this slide is just some feedback that we've gotten from our patients and our caregivers, talking about how Chronically Simple has positively impacted their lives. And then, open to questions. We've got our social handles here, and a promo code for you all to have free access to our premium subscription. And that's where you're going to get the multi-user functionality. You can integrate it with your Apple Watch or your Fitbit. In your symptom tracker section, you'll be able to track and manage your steps, your blood glucose monitoring, your cardiac information. And I think, that's it. I'll stop presenting, and I'm happy to just go back on. I don't know how I stop sharing my screen, and We've got, can you track PKU diet? I guess if I knew specifically what the PKU diet was, then I would be happy to figure out how we can track that for you. Tanya, I don't know if you want to share a little bit about that, or if we have the ability to do a live discussion, but
yeah, Christian, maybe you could let me know if you're looking for more than the blood Phe levels. Christy, we had talked earlier about
yes.
the blood spots get done and they'll come back with a number. I imagine that would get entered similarly to your symptoms, perhaps,
Yes.
that you would put in your number and that would give you your average as well as your highs and lows.
Yes.
So there's that portion that we had spoke about. We've also spoken about adding the Kuvan and any of the medications that are PKU related, intake daily of proteins and Phe in food. So it's, Christian, it's not going to do each individual food tracking, unless that's a module that they build out in the future. So what that would be, Christy, is that there are apps out there that if my son has a piece of toast, he can put that in there and it'll tell him how much protein was in that one piece of toast and how much Phe was in that one piece of toast.
Right.
So it can add up for the whole day until he gets to his magic number.
Okay. So that would be something we would need. Sorry, that would be something we would need to look at. So we don't have that functionality built out right now where it could track it to that level. But if there's an app out there that does that well, that's something that we could definitely look at, either integrating with or, seeing how they do it and then how we might be able to do it similarly.
The one that's the most popular, and actually we have Sarah on the line, like on the call as well. So Sarah has how much Phe, which is the Bible to a lot of the PKUers.
Okay.
But it would require having to open, unless you just took your daily amount from her app and put in that, yes, you hit your target for the day into this one. That would still allow the two apps, but there's a tremendous amount of work and effort that she's put into that. To ensure that it's updated regularly, and they do scientific breakdowns of food to make sure that companies are giving the right numbers that they should. So I don't know that that's something that could be umbrellaed into this.
Yeah, I think our goal is never to reinvent the wheel. It would be, there's lots of opportunities. I think about my girlfriend whose daughter has type 1 diabetes, and her pump is on an app, or it speaks to an app. And we would never want to emulate that. What we would want to do is talk to it. So pull that information in so that, again, the idea is ideally to have one centralized location that makes your life easier. If as a parent, you have to manage two until we figure out how we could best do that to serve your community. I think that would be a short-term answer, and then how we could look at this long-term would be more of a brainstorming session.
Perhaps there's a way that you and Sarah can connect that it'll take what you've eaten for the day and just put that number in.
Mm-hmm. Yeah, we could definitely find a place for that number, 100%.
Great questions.
Okay, the How Much app, the How Much Phe app is not free. Okay. So you guys pay for that. Is that a subscription-based app? Or?
It is subscription-based. CanPKU does have a number of $15 off vouchers, which I know doesn't cover the entire annual cost, but it helps with providing a bit of a subsidy. So Michelle, if that would be of advantage to you, certainly email into info@CanPKU and I can make sure to get you one of those, or anyone else who's on the call and wants one.
Chronically Simple is also a subscription-based app. So we do have a freemium version and a premium version. So for everyone that's on the call today and everyone that's in your community, we are offering free premium versions to everyone here. And that just gives you all the functionality that I walked through with you today. So it says on our website what is included in the free version and then what's included in the premium version. The main differences are the multi-user functionality, the integration with wearables, and I think the expenses section is a premium offering as well. But you guys will have access to that with the code that we've provided to you. no.
I do find a lot of the apps that are worth having come with a cost because there's a lot of background costs that come to making them, and that's where the cost comes from. Uh,
Yeah.
yeah, for sure. That's
Finding that balance on, it's my goal. My goal with starting Chronically Simple was to help patients and caregivers alleviate some of the burden that comes with living with a chronic illness or a disability or caring for someone in that situation. And we know that it is not, it's expensive to live with a chronic illness or a disability. And oftentimes it impacts your ability um, to maintain employment outside of the home, or if you're a full-time caregiver, finances are definitely a consideration. So I never wanted that to be a barrier to getting the tool in the hands of people that needs it. But unfortunately, it is a business too, and it does cost a lot of money to develop. So we're always trying to find that balance to make sure that we can support our patients and our caregivers and still keep the lights on and still be able to innovate, and make sure that we have conversations like this and sharing of ideas and bringing to market solutions that are relevant and meaningful and impactful to you. That's our goal.
if anyone has any thoughts towards how they would change or not change, but adapt the app to work for PKU, again, just send me that email. I'll make sure that it gets into Christy's hands so she can work her magic.
And Francis asked about the information being transferable. Absolutely. So that's a really good question. And I know from the work that I do with pediatric caregivers that transition to adulthood is a very, very scary time. And the idea is, and the use cases that we've been working with are the primary caregiver would get their team involved in tracking and managing and using the app, with the idea that when they transition into adult care, they have the ability to take it over themselves and transfer the primary caregiver to, you basically you shift ownership. So the child transitions into adult care and then hopefully keeps you on as a member of their care team so that you still have the visibility and the access that you need to make sure that they're getting the level of care that they need to remain healthy or stable.
Arlene, just to answer your question, you're saying, will it help calculate protein for those who don't count Phe? I think that whether it's a toggle or two different options, it's just two ways of tracking. So she would be able to enter in both options for you to use. So again, it won't track the value of protein or Phe in each thing you consume, but it can track your daily amounts.
Yeah.
You can get that number for it to be smart to have it. Christy, do you know when these protein values may be added to the app?
So if it's just as simple as adding, a spot in, I would probably house it in the symptom tracker. And if it's just adding a daily, to me, that would be adding, like we would house it the same. And if it's just putting in a number, so tracking those numbers every day, the ultimate final number, we could have that added as a new symptom pretty quickly. So if you just tell me, is it best as a sliding scale, or you want to ultimately add a 1 to 10, 20 to 30, I would just need to know kind of what the min and the max would be, and then make sure that it's either as a sliding scale or we don't do free form. We try not to do free form because it leaves room for error, but I'm thinking and solutioning this in real time. So you'll have to forgive me for not being as articulate as I probably should be, but I'm thinking like a wheel where you choose the number.
Okay.
But I could, like, that would be pushed in a maintenance update, within a few weeks, if that's all you're looking for.
Yeah, because a range for someone who is potentially off diet may be 1,000 or more of a range.
Okay.
Within diet, there's a couple to 300 that should be in that range. But yeah, if they're tracking because they're trying to get better on track, it may need to be a bigger number.
Okay, so I think if you and I take this discussion offline, and I just make sure that I've got, like I said, kind of like a min and a max,
Yeah.
then I'll figure out the best user experience for you guys to capture that.
Sounds good. Any other questions from the attendees?
Thank you very much for giving me the time to present to you today. I hope that you found it informative and worth your time. We built this tool with the feedback of our users. So if you are able to download it and you think that it would be beneficial for you and your family to use a digital solution to keep all of your health information in one place, if there's anything that is missing or that would make your life easier, just, I'm always accessible via email. And that's, like I said, that's how we continue to build our roadmap, is through our user feedback. So the history from the clinics is, that is something that we're working on. And ultimately the end goal is for us to integrate with your EMRs and the EHRs. That is a huge, huge undertaking. I've been working on it for 4 years, and it's like my life goal is to get that. Getting patients and caregivers real-time access to your medical records is a passion, and something that I work on more broadly outside of just Chronically Simple. I work on an Ontario health team for our region. I'm active in different boards and focus groups to help bring that, make those records accessible, so that, to your point, you can go into your healthcare provider and you see your medical records directly within the app in real time. It's not available right now, so the history from your clinics, you would have to ask for that and then upload that yourself, either scanning it or taking a photo of it with your phone and storing it in the documents section. But please do know that that is something that my team and I are actively working on, and have been and will continue to do until we hit a resolution to make that easier for all of us. Well, thank you. We'll give everybody 10 minutes back, I guess, if there's no further questions. But just thank you again. I really appreciate your time.
Thank you so much for your information, Christy. It's wonderful.
Well, it's very nice to virtually meet you all, and please don't hesitate to reach out if you have any further questions or feedback after you get into the tool and you play around with it. Take care.
Thank you.